What if artificial intelligence could serve as a second set of eyes with your doctor, operating as kind of a second opinion?
To give you an idea,
We visited Dr. Irene Wong in her research lab to see it in action.
there are more than 400 MRI slices.
She's the research director of the Epilepsy Center at the Cleveland Clinic, where AI is already making a difference.
What if your watch knew you were sick before you did and booked your doctor's appointment while you were still sleeping? Sounds like sci-fi. Well, buckle up, because the future of healthcare is smarter, sassier, and already here. Let's rewind to the chaotic healthcare system of the 2020s. Overcrowded hospitals, burned-out staff, 3-hour wait times for a 5-minute consultation. Remember Googling your symptoms and thinking you were dying? Yeah. Well, by 2030, that era is officially canceled. Instead, AI takes the wheel, detecting symptoms before your nose even runs. It pulls data from your smart devices, your environment, even your late-night snack habits. Yes, it's watching. The healthcare system transformed from reactive to proactive, from waiting rooms to wearable tech, from take 2 aspirin and call me in the morning to your eye already called your doctor and booked a follow-up. But how did we get here? And is AI really smarter than your doctor? Let's find out.
Artificial intelligence is being used to expand the power of radiology and medical imaging.
The thing that I think confused a lot of people early on when AI was being introduced into healthcare was it was going to be a panacea, maybe it was going to replace humans in this process, or that general AI was going to be able to look at massive records and make massive decisions.
How we can now interpret them more effectively and without as much expertise needed. We are like seeing the old patterns of care change into new ways of doing care.
The topic of how is AI going to be used is so interesting because these new machine learning, sophisticated models, they aren't the end of the question, it's the beginning of the question.
The transition didn't happen overnight. Years of hospital meltdowns, doctor shortages, and skyrocketing chronic illness forced the system to evolve or collapse. Meanwhile, AI was quietly leveling up, learning to read EHRs, analyze MRI scans, and yes, even understand your cough patterns. By 2025, healthcare started shifting. Smart devices weren't just tracking steps, they were tracking stress, blood sugar, and how many times you yelled at your Wi-Fi. Governments and tech giants teamed up for once. Hospitals went digital, and suddenly, healthcare was less hurry up and wait and more. Hey, your AI said you're running a fever, take a break. But the biggest plot twist, hospitals stopped being the center of healthcare. Let's go there. Predictive healthcare becomes the norm. Let's start with this. AI doesn't wait for symptoms, it predicts them. You wake up groggy. Your watch already told your AI you're acting off. I send your doctor a summary. Looks like early flu. Already scheduled a test. You're welcome. And guess what? You didn't even open your eyes yet. This tech goes beyond just your vitals. And now factors in things like local pollution levels, your diet. Yes, it clocked that 2 a.m. shawarma. Even your job stress. That's not paranoia. That's personalized prevention. Hospitals, but make it mobile. The old hospital, a stressed-out building full of overwhelmed staff. The new hospital, your home. A nearby clinic, your phone. AI works like a healthcare air traffic controller, directing patients, doctors, and even supplies across the system automatically. It tracks every bed, every staff member, every oxygen tank. No drama, no chaos, just data and decisions. Need surgery, you'll still go in. Need a prescription refill or minor procedure. That's a video call in your pajamas. And wait till you hear how AI is making healing at home even better than in a hospital. Doctors breathe again, literally. AI handles admin, scheduling, note-taking. Nurses get more time with patients. And patients? No 3-hour waits. No clipboard nightmares. Just care that shows up when it's needed. Meanwhile, your AI quietly reminds you. Take your meds. You haven't slept well. Your tone of voice suggests burnout. Maybe meditate instead of scrolling TikTok. Funny thing is, all this tech made things feel more human, not less. By the way, what do you think? Would you let an AI monitor your moods and meals if it meant fewer hospital visits? Let us know below. Here's the wild part. The better I got, the more trust it had to earn. Bias? Yep, early models only worked well for certain demographics. So, The industry went back to the drawing board. Diverse data sets, transparency, and ethics became the focus. And slowly but surely, the fear faded. I wasn't here to replace doctors, it was here to support them. By 2030, chronic illness rates are falling. People recover faster. Healthcare access is more equal, urban or rural, rich or poor. Most importantly, doctors are staying in the job longer. Because now they're not drowning in paperwork, they're actually healing people again. But what if AI gets too smart? What if it starts making decisions we can't understand or worse, control? That's a topic for another video. The future of healthcare isn't a sterile lab full of robots. It's your own living room. It's your smartwatch whispering, "Go get checked," before you even feel off. It's AI doing the heavy lifting, so humans can get back to being human. If this blew your mind even a little, don't just bounce. Hit subscribe and check out our next video. 5 medical lies you still believe, backed by science. Yeah, you're probably falling for at least 2 of them. Let's fix that. Stay curious, stay healthy. And if your watch said as you're dehydrated, go drink some water. Your eye is watching.